My new video about the reasoning questions of the blood. So first question is that what will happen if the folic acid is given to pernicious anemia patient? So if folic acid is given to pernicious anemia patient, it will improve only the blood picture of the pernicious anemia. But while the vitamin B12 that protects against the neuropathy and folic acid has no such effect, means it does not protect against the neuropathy, and it may also accelerate the development of the nervous lesion. So if we give folic acid to pernicious anemic patient, then it does not protect against the neuropathy, but it only and only improve the blood picture of the pernicious anemia. Then atrophy of the gastric mucosa leads to pernicious anemia. Now intrinsic factor of the castle that is produced in a gastric mucosa by parietal cells of the gastric glands. Then it is essential for the absorption of the vitamin B12 from the intestine. Now in the absence of the intrinsic factor, vitamin B12 is not absorbed from the intestine. So that leads to pernicious anemia. Now in the pernicious anemia, the RBC are immature and that are larger with almost normal or slightly low hemoglobin level, and synthesis of the hemoglobin is almost normal in this type of the anemia. So cells are macrocytic and normochromic or hypochromic. Plasma protein helps in coagulation of the blood. So plasma protein helps in coagulation of the blood due to presence of fibrinogen and prothrombin and other coagulation factors which are protein in nature. So in this way plasma protein helps in coagulation of the blood. Hypoproteinemia means decrease in plasma protein level that leads to edema. How? So hypoproteinemia means decrease in plasma protein concentration. That decreases the colloid osmotic pressure and therefore increase filtration that occurs at the arterial end and decrease in absorption of the fluid at the venous end, so that it results in an abnormal collection of the fluid in the interstitial space, and that condition is known as edema. So in this way decrease in plasma protein level that leads to edema. Now pernicious anemia occurs in gastric ulcer, severe gastritis and gastrectomy. In all these conditions pernicious anemia occurs. Why? So intrinsic factor of the castle that is produced in gastric mucosa by parietal cells of gastric glands, and it is essential for the absorption of the vitamin B12 from the intestine. Now in the absence of the intrinsic factor, vitamin B12 is not absorbed, so it leads to pernicious anemia, and RBC are larger and immature with almost normal or slightly low hemoglobin level, and synthesis of the hemoglobin is almost normal in this type of the anemia. So cells are macrocytic and normochromic or hypochromic. Now blood helps in maintenance of body temperature. So it helps in maintenance of the body temperature by three ways. First is specific heat of the blood that is very high, and that is useful in buffering the sudden changes that occurs in body temperature. Then high heat conductivity of the blood that renders it possible for the distribution of the heat from the deep organs to the skin and lungs for dissipation. Then third is due to high latent heat of evaporation of the blood. A large amount of the heat that is lost from the body by evaporation of the water from the lungs and skin. So by these three ways the blood helps in maintenance of the body temperature. Then blood does not clot in vivo. So there are so many reasons, that's why the blood does not clot in vivo. So antithrombin 3 is a circulating protease inhibitor and it inhibits the active form of the clotting factors like 9, 10, 11 and 12. And the platelet aggregating effect of thromboxane A2 is balanced by anti-aggregating effect of prostacyclin and which causes clots to form at the site when the blood vessel is injured but keeps the vessel lumen free of the clot. Then third reason is heparin, that is a naturally occurring anticoagulant that facilitates the action of the antithrombin 3. Then removal of the activated clotting factors by the liver. Then fifth reason is smoothness of the endothelium that prevents the platelet adhesion and extension of the clot into blood vessels. Then sixth reason is negatively charged particles that is present over the endothelial lining that repels the clotting factors. Then continuous movement of the blood that does not allow the clot formation. Then simultaneous activation of the fibrinolytic system along with the clotting mechanism. So for these all reasons the blood does not clot in vivo. Then reverse anemia occurs after gastrectomy. So reverse anemia occurs after gastrectomy because gastric secretion plays an important role in dissolving the iron, thereby permitting it to form soluble complexes with ascorbic acid and other substances that aids its reduction to ferrous form. So this is very important for the absorption of the iron in the duodenum, even though only traces of the iron absorption occur in the stomach. Then aspirin is given in myocardial infarction or stroke. So administration of the aspirin in low doses that shifts the balance towards prostacyclin by inhibiting thromboxane A2 and also inhibits the platelet aggregation. So in this way, aspirin is helpful to prevent the myocardial infarction and stroke by preventing the platelet aggregation. Then reticulocyte count increases after vitamin B12 therapy. So after given a vitamin B12, there is a reticulocyte response occurs. Now what is the reticulocyte response? So increase in number of the reticulocyte count after the vitamin B12 therapy. And this is due to proliferation of the bone marrow and numerous young RBC that pass into the circulation. Hematocrit value of capillary blood is lower than that of the actual blood. Why? So hematocrit value of the blood in microcirculation vessels means meta-arterioles, arterioles and capillaries is lower than that of the actual blood. Now in these small vessels, the red blood cells tend to move in the center of the bloodstream means axial flow and leaving the cell free zone of the plasma at the periphery. So at the periphery there is a only flow of the plasma means free of the cell and in the center of the vessel there is a only red blood cells flow means axial flow. As a result, blood along the sides of the vessel has a low hematocrit and branches living at the right angles may receive cell poor blood. So at right angles may receive cell poor blood. So in capillaries the effect is marked. All these effects are mainly seen in the capillaries because the capillaries has a very small diameter. So because the RBC move only in a single file in the middle of the stream and this phenomena is known as plasma skimming may be responsible for the capillary blood hematocrit being about 25% lower than the whole blood hematocrit. Now, venous RBCs are more fragile than the arterial RBC or PCV of the venous blood is slightly higher than that of the arterial blood. Now, as a result of chloride shift, the total number of the iron inside the RBC increases. So the osmotic pressure inside the RBC becomes higher than that of the plasma due to chloride shift. Okay, so that causes osmotic absorption of the fluid into the RBC or red blood cells. So red blood cells that have imbibed some quantity of the water. So the venous RBCs contain a greater quantity of the fluid as compared to arterial blood RBC. Now edema that develops in hypoalbuminemia. So hypoalbuminemia or hypoproteinemia means decrease in concentration of protein or decreased concentration of albumin. That causes a decrease in colloid osmotic pressure. Therefore, increased filtration that occurs at arterial end and decrease in absorption of the fluid at venous end, that resulting in abnormal collection of the fluid in interstitial space, and that is known as edema. So in hypoalbuminemia that edema develops. Now clinically the jaundice that is first detected in the sclera. So first site where the jaundice is clinically detected is the sclera because the sclera is white in color and yellow discoloration is more obvious than a similar discoloration of the brownish skin. And sclera has a protein that is elastin and which has an extremely high affinity for binding with bilirubin. So clinically the jaundice is first detected in the sclera. Now phototherapy or exposure to light is of value in treating infants with jaundice irrespective of its cause, or phototherapy is helpful in treating neonatal jaundice or jaundice of newborn. Now exposure of the skin to white light that converts bilirubin to lumirubin, which has a shorter life than bilirubin, and it acts by photoisomerization of the bilirubin to soluble form, so which are easily excreted. So there is a decrease in concentration of the bilirubin. So in this way the phototherapy that is helpful in treating neonatal jaundice or jaundice of newborn. Now physiological jaundice that is more common in newborn babies or premature babies. Now after the birth there is excessive destruction of the RBC occurs that causes increase in serum bilirubin level. Now due to hepatic immaturity during the intrauterine life, the bilirubin is mainly eliminated via placenta and to lesser extent by liver. Now immediately after the birth, the liver has to eliminate all the bilirubin formed. Therefore, liver is unable to deal adequately with this increased amount of the bilirubin during the first 10 days of the life, causing development of the jaundice. That is why the serum bilirubin continues to rise after birth to a peak, which is generally reached during the first week and then it declines, and it is more common and of greater severity in premature babies. Then anemia can never be hyperchromic. Why? So anemia means decrease in RBC count below 4 million per cubic millimeter. Now in single RBC cannot be hyperchromic because the amount of the hemoglobin cannot increase beyond the normal level. Then calcium deficiency does not produce coagulation defects, because the only traces of the calcium are required for the coagulation. Even if very severe calcium deficiency occurs, it may produce other symptoms like tetany before the coagulation disorders develop. Then pathological jaundice in infants lead to kernicterus or encephalopathy. So this pathological jaundice that occurs in hemolytic disease of newborn and that results due to Rh antibodies. Now, kernicterus means damage of the globus pallidus caused by indirect or unconjugated bilirubin, which crosses the blood-brain barrier because of its hydrophobic property. Now, kernicterus, when it develops. So, when the concentration of the unconjugated bilirubin in the plasma that exceeds that which can be tightly bound to albumin and it exceeds above 20 to 25 milligram per deciliter, it enters into the central nervous system and it can cross the blood-brain barrier because in infants the blood-brain barrier is not fully developed as it is developed in adults and it enters into the brain mainly in the parts of basal ganglia where it is deposited and that condition is known as kernicterus and it leads to encephalopathy. Now, erythroblastosis fetalis is why it is called erythroblastosis fetalis. So, severe hemolysis in the fetus that causes jaundice. To compensate the hemolysis of more and more number of the RBC, there is a rapid production of the RBC, not only from the bone marrow but also from the spleen and liver. Now, many large and immature RBCs in the pro-erythroblastic stage are released into the circulation. So, because of this reason, this disease is known as erythroblastosis fetalis. Hemophilia B is known as Christmas disease. So, Christmas disease or hemophilia B, that is due to deficiency of factor 9 or Christmas factor. So, Christmas factor was so named after the patient in whom it was discovered, so that the hemophilia B is known as Christmas disease. Thank you very much.